Hello again. Good to see that you're still here. This is the last section of the video. Our final segment presents a series of scenarios. Each scenario presents two different versions of an experience. Today's feature presentation
Hello. I have a 2 o'clock appointment. Do I need to sign in?
No, you don't have to sign in. I'll look up your appointment. What's your name, miss?
Actually, it's Mr., not Miss. My name is Joe. Joe Brown.
What?
My name is Joe Brown.
Joe Brown.
Yes, Joe Brown. I have a 2 o'clock appointment.
Well, you sure don't look like Joe Brown.
We haven't met before. I'm a new patient.
That's not exactly what I meant.
I know what you meant. Can you just verify my appointment and give me whatever forms I need to fill out, please?
Sure. Here you go. You can have a seat over there.
Thank you.
Oh no.
Oh,
that was
man.
terrible.
Hello. I have a 2 o'clock appointment. Do I need to sign in?
No, you don't have to sign in. I'll look up your appointment. What's your name, miss?
Actually, it's Mr., not Miss. My name is Joe. Joe Brown.
Excuse me, Mr. Brown. Yes, here you are. 2 o'clock with Dr. Harris.
Yes, that's right.
Are you a returning patient, or is this the first time you've come to see us?
I'm a new patient.
Okay, I have some forms for you to fill out. Please have a seat over there, and the nurse will call you when Dr. Harris is ready to see you. You can drop the forms with me when you're done.
Thank you.
All right.
That happened to me the first time I came here. Hi, I'm Andy.
Hi, Mandy. I'm Joe.
Yes, Joe Brown, we know.
Ouch.
Bruce and Kevin Porter, Dr. Harris will see you now.
So, how long have you been coming here?
About 6 months.
And how is it?
You know that sitcom where everyone knows your name?
Uh-huh.
Well, this ain't it. They don't know your name or your pronoun. And perish the thought you should bring your spouse.
What about... They sort of seemed like a couple. Or not.
They seem to have the gay, lesbian, and bisexual stuff nailed. It's the transgender they don't get. Haven't gotten it yet. They just assume we're all the same.
So, why do you keep coming?
I don't have a whole lot of choice. No car, not a whole lot of cash, and just forget about health insurance. It's the only place that I can get to that I can almost afford.
Yeah, me too. What about Dr. Harris?
He's okay, I suppose. Confused, clueless about transgender people. Seems uncomfortable whenever I come see him, like he's afraid I'm gonna do something transgendered. I think he's good with the medicine part, but his discomfort makes me uncomfortable.
I know what you mean. I just wish that if a clinic is going to advertise to us, they'd be ready and able to serve us when we come in.
I'd be happy if they could just see us. Really see us, you know? But yeah, it would be nice to walk into a clinic someday and not have everyone act surprised or confused.
Even the forms are bad. The choices for gender are male or female. No way for me to indicate that I'm transgender. And look at this. The past medical history is divided into 2 separate columns. One for male, one for female. This is stupid.
Check them all.
I should, just to see what happens. No, I guess not. I guess I'll have to have a one-on-one with the doctor and explain it all.
Good luck, brother. Gum?
Thanks.
think so.
man.
Oh, no.
That happened to me the first time I came here. Hi, I'm Mandy.
Hi, Mandy. I'm Joe.
Yes, Joe Brown, we know.
Ouch.
Bruce and Kevin Porter, Dr. Harris will see you now.
How long have you been coming here?
About 6 months now.
And how is it?
They're really good here. Cindy will never get that wrong again. At least almost never. As long as you're consistent, so is the staff.
Really?
Really. She maybe got that wrong with me once or twice in 6 months. Once I showed up in some raggedy old sweatsuit. I had been painting my house, and I don't think she recognized me right away. But she's always good about using the right pronoun and using my name.
Well, I'm impressed already.
I know, isn't it great? It's so simple, and yet it's so important.
How about Dr. Harris?
Oh, I really like him. The first time I saw him, I told him straight out, I am a transgendered woman. I am not a man in a dress.
What did he do?
He smiles and says, okay, so where does it hurt? I just busted up laughing. He had this big friendly smile, and I knew it was going to be okay. The first time I came, we mostly just talked about me and what I needed, what I wanted.
So, how's his knowledge of transgender people?
Pretty good. He's not a specialist or anything, and he often has questions for me, but he listens well and knows how to give helpful feedback. If I bring him something to read, I know he's read it by the time I come for my next visit.
That's amazing. That's so different from some of the experiences I've had. The docs always want to talk to me about everything except what I want. They either ignore the fact that I'm transgender or they act like that's all I am.
Well, this is a good place. I like it here. Check out the forms.
I can't believe it. Look at all the choices for gender. I've never seen anything like it before. And everything else looks like it's all gender neutral. No assumptions or restrictions. This is great.
And check out the brochures. They have a local referral list for transition services and other doctors, and some health updates just for transgendered people. Oh, and if you have a spouse, you never have to worry about coming as a couple or bringing along your partner for moral support. They really understand how important that support can be.
I think I'm gonna like it here. Thanks for the heads up.
All in a day's work.
All right.
Very good. Very good.
That's it. There it is.
Dr. Harris, this is Joe Brown. Your 2 o'clock appointment?
Thank you. Hello, Miss Brown. Please, have a seat.
Actually, it's Mr., not Miss.
Ah, yes. Joe Brown. I knew a woman named Joe once. Well, I guess it's a common nickname.
It's not a nickname. It's my name, and it's Mr., not Miss.
Ah, I see. Transgender. Yes, you checked both male and female. So which is it? We really need to know for medical reasons. Which is it?
Can you tell me what my sex has to do with the problem I'm having with my knee? It's swollen and retaining water.
There's no need to be defensive. I'm simply trying to determine your sex so that you can get the proper medical treatment.
My sex doesn't need medical treatment. My knee does. I've already had it bandaged by your nurse practitioner, Paul, who, by the way, was just as insistent as you are about my sex. I can't imagine why, unless it has something to do with the preferred color of the bandage. We finally had to decide on basic beige, and Paul didn't seem too happy about that. I think he really wanted to give me the pink bandage, but I said no.
You know, we're committed to providing the best care we can to all of our patients. Male and female patients have different needs. We're happy to treat transgender patients, but we need them to cooperate with us like our other patients do.
Great. I'll cooperate by taking whatever you prescribe to reduce the swelling in the water.
All right. I'm prescribing prednisone for the swelling and a diuretic for the water.
Will any of these drugs interfere with the testosterone I'm taking?
Prednisone is a steroid. It probably shouldn't be combined with another steroid like testosterone. I'm not sure what the effect would be. You shouldn't have any troubles with the diuretic.
What would you recommend that I do?
Stop taking the testosterone.
That's really not an option. I've been on hormone therapy for 6 months. It's too early to interrupt.
Then take aspirin or ibuprofen instead. If you're not sure, check with the doctor who's administering your hormone therapy.
Thanks.
Make an appointment for a follow-up visit in 10 days.
I need a note for my work.
You can get one at the front desk on your way out.
Oh, no.
No.
Yeah.
Dr. Harris, this is Joe Brown, your 2 o'clock appointment.
Thank you. Hello, Mr. Brown. Please, have a seat. Do you mind if I call you Joe?
That would be fine. I would prefer it, actually.
All right. I understand you've already seen Paul, the nurse practitioner, and he's examined your left knee, swelling and water retention.
Yes, that's right. Paul wrapped it with an elastic bandage, and I'm supposed to get a prescription from you, something to take down the swelling and get rid of the water.
Yes. Before I write a prescription, I wanted to talk to you about any other medications you might be taking. You indicated on your history form that you had been taking testosterone. Are you still taking testosterone at the same dosage?
Yes.
Okay. One of the drugs we normally use to reduce swelling in the knee is a steroid. I'm hesitant about prescribing it while you're being treated with testosterone. Testosterone is another type of steroid.
Yes, I know.
You also noted on your history form that you're transgender, female to male. Is the testosterone being administered as part of your gender transition?
Yes.
Okay. I don't want to raise your risk for high blood pressure or lower your resistance to infection by administering another steroid. And frankly, I'm not sure if administering another steroid would have a negative effect on your hormone therapy. I'm going to recommend that you take an over-the-counter anti-inflammatory like buffered aspirin or ibuprofen instead of the steroid. I'll write you a prescription for something that'll help your body rid itself of the excess water, keep your leg elevated, and stay off it as much as possible for the next 5 days.
All right.
Is there anything else you wanted to talk about today?
No, not really. But, well, I just want to say that I was really concerned about coming here today. I've had some less than positive experiences with doctors in the past, but I had a good experience today, and I'm sure that if anything comes up, I'll ask you about it.
Good enough. Do you need a note for work?
Yes, that would be good.
You can get one of those from Cindy at the front desk on the way out. You can take this to the pharmacy here or any pharmacy you like. Cindy will give you an appointment for a follow-up visit in 10 days. If the swelling doesn't go down or if the knee gets worse, call right away.
Thank you, Dr. Harris.
The door at the end of the hall lets you out to the waiting room. Think about scheduling a basic health checkup sometime soon so that we can keep you healthy and on track toward your personal goals.
I will. Thanks again.
Nice meeting you, Joe. See you in 10 days.
Very good.
rock,
Very
Doc.
good.
Right.
Oh, that's great. Oh, that's
That's
so much
it.
better.
Before I go, I'd like to thank you for your participation in the workshop today and encourage you to keep on learning and gaining new experiences with all kinds of people. Life is just more fun that way.